You're listening to The Health of Business, where we talk openly and honestly about what it takes to run a healthcare clinic business in BC and Canada today. I'm Danielle Boyd, and I'm glad you're here. A quick reminder before we jump into this week's episode is that this is your last chance to get the Business of Physio 101 course at the early bird price and save $100 on your registration. Courses begin on March 11th, and January 15th is your last chance to snag an entry at the early bird pricing. This course isn't just for clinic owners. This is for anyone who is working in the private sector who wants to understand how clinics actually function, how money flows, and how business decisions affect your career. Things like contracts, IC versus employee models, incorporation, all the things that affect your career as a clinician or as a clinic owner. Early bird pricing again ends at 11:59 p.m. on January 15th. And to sign up, visit danielleboyd.ca/courses to snag your registration. There's also the option to upgrade to a one-on-one call with me after the course is complete. So for an extra $100, you get an hour with me to look at anything specific to your career. That's also included in the early bird pricing. So again, that's danielleboyd.ca/courses. And I look forward to seeing you in March in class. Hello, and welcome back to the Health of Business podcast. This one is a fairly technical one, but one that I think is so important. It's something that, quite honestly, I didn't even know was an issue until fairly recently. And I suspect many clinic owners and corporate permit holders also don't know this. I am quite confident that that is the case because I know structure issues exist fairly ubiquitously across the province and country. So this one is specific to BC because our colleges in BC are the ones that govern this. But I believe it is a similar structural issue across the country. So I'd love to hear from you if you're from a different province about how this works. But this one is very specific to BC and how our corporate permits are structured and permitted and what we can and cannot do with these permits in the province from a healthcare perspective. So the big thing I want to say before I jump into the technicalities of it, again, I'm not a lawyer. I'm not an accountant. I am certainly not a professional in that regard. But what I am doing is taking publicly available legislation, bylaws, information that's available on all the websites, our college websites, and I'm amalgamating it. I've also spoken with the college about this, confirmed my interpretations as well, and have spoken to a number of different entities that have all confirmed this. So this, again, like I said, is fairly technical, but if you are a clinic owner or you're a sole proprietor or you are a corporate permit holder, you're an incorporated entity in BC as a healthcare practitioner owner, this is essential. So basically, if you work as a healthcare practitioner with a college, this affects you because if you're an owner, this affects how you bill and what you bill for and what you cannot bill for. And if you are a practitioner, this affects what your clinic is doing on your behalf. You should absolutely be aware of who you're fee splitting with, who you're paying rent to, and who is billing on your behalf. So this is also becoming a lot more important as we move into HPOA on April 1st, 2026, because the legislation that surrounds our new healthcare governance is, we'll just say it's a little bit more big brothery than HPA and our previous legislation. So with that, there is some good news that I'll sprinkle in at the end, some optimism around this. But in the meantime, I will do my best to guide you through this issue because it is something that I know is a pretty big one in the province, and why it matters and what's really, really important here. So The big thing I want to express is that this actually isn't a tax issue. This is very much a regulatory compliance issue. This is more of a college issue and a government legislation issue. So this isn't a CRA thing. This isn't an employee or IC conversation. This is very much your corporation structure. And quite honestly, the CRA doesn't really care about your corporate structure, whether you're permitted, non-permitted, and what you're billing for. They just want to know that you're doing it correctly and that your staff are classified correctly. It's the colleges and the government that actually care about how you're using your corporate permit. So this is really under that vein. So this is more of a permit regulation government component, and that's who actually enforces this. And it is going to be enforced through the Health Professions and Occupation Act as of April 1st, which, like I said, quite a bit more legislation that we have to think about and worry about. It's going from, I think it was 30 pages maybe of legislation with HPA, and it's well over 300 moving forward. And there are a lot more restrictive and like I alluded to, kind of big brothery type clauses within it. So let's dive in. So most practitioners or clinics operate as one of three types of business structures, and there might be some flexibility or difference within all of this. But the three buckets that most operations and entity operate within are: one, as a sole proprietorship, or just like as an individual. So if you don't have a corporation and you're an independent contractor, most practitioners are operating just as a sole proprietorship, whether you've registered your name or a business name or not. You might have a trade name, or you might have just like your name. So before I incorporated, interestingly, fun fact, I actually just dissolved my corporation. I went through that. So that's kind of an aside, but I realized, for a number of these reasons that I'll dive into, as well as for financial reasons, I just wasn't really billing enough through my corporate structure anymore. And because consulting, I cannot run through my corporation, like I didn't realize. So having done a deep dive into this recently because of my shift in what I'm doing, I can't run physiotherapy business consulting through a physiotherapy corporation because it is not physiotherapy, and you cannot bill anything that is not your healthcare profession designation through a corporation. So for that reason, the majority of my income in the private world right now is actually coming from education and consulting. I couldn't run it through my corporation. The few clients I do still see privately were not worth enough financially to me to maintain a corporation. So I just went through the process of dissolving it. So if anyone has any questions about that, more than happy to dive into dissolution, because that was a new experience that I actually didn't really anticipate having, but have gone through and learned a lot. So anyway, total aside there. But back to the buckets here. So bucket one, like I said, sole proprietorship. So now I am a sole proprietor again. And through my sole proprietorship, have multiple different income streams. And so I've picked up my trade name, my clinic name, the Balanced Collective, again for my physio clinic. So I've just basically shifted the ownership of that name. And now it's just owned by me as an individual. I haven't even registered a sole proprietorship. I just have a business number and that's it. So you don't need a corporate permit for this. And I still obviously am under college compliance for how I bill my physio and what's on the receipts. And, I am still bound to the ethics and standards that we all are as professionals here. But as a sole proprietor, I just don't run it through a separate corporate structure and have to deal with all of that and pay accountants and lawyers and all of that jazz to maintain it. It's now just a sole proprietorship. I'm still a business. It is still very much a business. I registered my name as a business. And so then I've also registered a separate business as a sole proprietorship for consulting. So essentially I just have two sole proprietorships, and that's fairly straightforward. So the second bucket, or the second structure, is the one that probably most clinic owners go for. And this is a permitted health corporation. So if you have a corporation and it's not permitted and you're billing physiotherapy through it, big no-no. We'll dive into that in a moment. But if you are a physiotherapist and you've gone through this process of, obtaining your permit through the college, you have a permitted health profession corporation. So This is separate from the third bucket, which is a general or a non-permitted corporation. So a permitted corporation is the one that exists under the health legislation. This is what's managed by our colleges and our government. So HPA and soon to be HPOA are the legislation that govern these permitted structures. So it is profession specific. You get a physiotherapy corporate permit or a chiropractic or an RMT or a naturopathic. You get that and you obtain it from your college, and you require an active permit every year. So every year you pay your corporation fee and you get your permit again, and you're able to perform business under the Health Professions Act and soon to be the HPOA Health Professions and Occupations Act. So you are subject to those restrictions and profession-specific requirements with your healthcare permit. And we're going to dive into those because those are highly restrictive and a lot more restrictive than I think a lot of people know, including myself previously 6 months ago. So the third one, like we said, is a non-permitted or a general corporation. These non-permitted corporations cannot bill for a protected service. So a non-physio corporation or a general corporation cannot bill for physiotherapy. The legislation does not allow it. And I know there are many general corporations out there that are billing for physio, chiro, RMT, all the permitted types of services. And so vice versa, a physiotherapy permit cannot bill for other services. They can only bill for physiotherapy. And so this is super, super important because there's a lot of blending and crossover and things that are actually happening in our world. So to be more specific here, a health permit corporation, this is where the enforcement lives, and it exists only under one health legislation. So a physiotherapy permit cannot bill for RMT, for physicians, for, naturopathic over here. Profession specific, like I said. And the other thing is it cannot bill for non-physiotherapy. And that's not even just services. That's things like wellness or fitness or Pilates or products and t-shirts and merch and all of those types of things. You can't just sell, random things through it. If you are going to sell products, they have to be physiotherapy adjacent. So things like TheraBand, it has to be, your yoga mats or whatever that is at least physiotherapy adjacent. And we're still bound to the ethics and standards around product sales. So things like it has to be sold for a reasonable price, and you have to be able to provide alternatives for where people can get it. And as physios, we must prescribe exercise in a way that does not require them to purchase equipment or product from our clinics. So we can sell product, but it is completely bound to the ethics and standards with which our college regulates us. So any product that is unrelated to physio, so say you want to have a coffee bar in there and sell coffee and smoothies, you cannot run that through your physiotherapy corporation permit. So things like consulting for me, I cannot run consulting through my physio permit because it's not physiotherapy. And the reason for this is it's meant to protect the public. We do not want the public confused about what physiotherapy is. So the college really is trying to protect that title. Our titles are protected, right? Like physiotherapist, physical therapist, remedial gymnast. These titles are protected. And the reason for that is for public protection. We want them to know exactly what they're getting when they purchase from us. So the corporate structure protects this and protects the public from having anything be confused for physio. So by selling RMT through a physio corporation, we are confusing the public around what it is. That's the reason for it. I didn't make the rules. I'm just a messenger on this one. So on the flip side of that, a non-permitted corporation is something like a management company. So say a company that sells rent. You might sell space or rent or admin. You might sell product. You might have that coffee shop. You might do consulting. These are all fine things to run through a general corporation. You just cannot run your service through it. Any service, in fact, that is protected. So that's the flip side of it, right? So this is all very confusing. There's a lot to it. But the college's reasoning, again, is very much around the protection of the public and the protection of the title. Services that are directly related to physio, this is where I find it a bit gray, quite personally. And this is the actual like college, like this is what it says in the legislation. A health profession corporation must not carry on any activities other than the provision of health profession services and services that are directly associated with the provision of those services that would give rise to income. If the service could exist without physiotherapy, it probably cannot go through a physiotherapy corporation. So what I mean by that is if the service is something that a patient could purchase without their physio session having happened, for example, a fitness class or a skipping rope, that probably shouldn't go through your corporation. However, if they need a TheraBand because they had a physiotherapy session and you happen to have that TheraBand and you've also done your due diligence and provided them alternatives for where they can seek it and you've priced it appropriately, then that's probably fine, right? A note on selling product. I've seen this question come up quite a bit through different clinic owner chats. Some people have asked if we're allowed to mark product up. We are, and it just has to be reasonable. The big difference here is like, there is a cost to stocking it, right? Like just because we paid a cost for, acquiring the TheraBand and we've purchased it at cost doesn't mean we have to pass it along at cost because we've paid shipping for it. We've been holding it, storing it, that space usage, the administration of, like putting it into your system and, like all of that stuff has a cost to it. So we are allowed to mark it up. It just has to be reasonable and for like, standard where you would, similar pricing to where you would buy it at a different store. It just cannot be like massively overpriced compared to somewhere else. That's a completely separate system there. So yeah, so that's what a health corporation can bill for. So for example, like a naturopathic clinic, they're allowed to sell supplements because often those supplements are prescribed during a session. So again, they have their due diligence that if they prescribe a supplement, they have to offer alternatives for where to buy it. They don't have to encourage people to buy it from their clinic, but if they have it and it's been prescribed, then by all means, that's something that's reasonable for them to sell as long as it's priced reasonably. Again, so yeah, I think we've been fairly thorough here in terms of what people can bill, cannot bill, and what the restrictions are. Again, the college is they're very clear on this. And again, the college isn't here to like help us build our businesses. The college is ultimately here to protect the public. So they really don't care. They realize this is restrictive. Like they understand that this is a restrictive way. It doesn't allow us to grow our clinics, especially, with the direction of multidisciplinary clinics. Yeah, it's highly restrictive. It's really challenging. And, again, many people don't know this. So, it's really problematic. And the thing is like the college also really hasn't enforced this publicly. I know that most of these things are probably settled, before they become public. There's no like court settlement precedents of these. And so what the disciplinary action is, I'm not entirely sure. But again, like I said, with HPOA coming in, it's really important that we fine tune our structures, our contracts, all of these things, because HPOA it's a lot more big brothery and we're going to get into it. Like it's really challenging. So yeah, again, non-permitted corporations can't bill for physiotherapy, and physiotherapy can't bill for anything that a non-permitted corporation can. We're very siloed, very isolated, and a lot of people are probably like, well, then how on earth are we ever going to build a business or have other practitioners or like find opportunities to grow outside of services? There are ways around it, absolutely, and there are other structures that are ways of doing this. So here's a few things that are allowed. So for example, in a multidisciplinary clinic, you can have independent contractors with a rent model. So your physiotherapy permit or corporation is able to sell rent to another corporation or to another sole proprietor or contractor or individual, because that's not confused with physio, right? Like that's selling rent. That's a different thing. So an option is for you to collect rent on behalf of all of the staff in there, and then they bill their own billings, right? So if you have an RMT, they just pay you rent and then they collect all of their billings, and that's a much cleaner corporate structure. And then the clinic basically offers rent, space, equipment, admin, Jane, whatever you want to include in that. but they just pay you rent. That's also way cleaner from a CRA perspective, as opposed to a fee split model or an employee model, especially if you've got other disciplines in there. Again, the CRA doesn't really care about this permit piece. This is the college and the government. So take that as you will. So another common and compliant way that clinics are doing this is they actually operate two separate corporations, or one sole proprietorship and one corporate structure. And what they do is they have their physiotherapy or their chiro or their RMT or their naturopathic health profession where they bill only that specific service. So for example, let's say I open a clinic and I have 5 physios and then, 5 other types of practitioners. I bill all the physiotherapy through my physiotherapy permit, and then anyone who is not a physio, another physiotherapy is a practitioner, so anyone who's not a physio but is providing a different service, they either pay me rent, or I have a general corporation through which they pay rent into, and then we sell all of our wellness programs and everything like that. And then I just charge rent and admin into that one, so I can have my, my fitness, my merch, my YouTube channel, my consulting, and all of that stuff goes into a general corporation, and then all the physiotherapy billings and services go through that corporation. And then I kind of have 2 separate ones that are operating in parallel to each other. And then the other practitioners who are non-physios just pay rent to, probably better to keep it into the general one just to keep it even cleaner there. So a big part of this is it's challenging because you have separate accounting, you have, separate invoices that have to go out. A patient might get confused about who they're paying or how that's structured. So you have to make sure your receipts are really distinct and that's really clear. And so, yeah, it is challenging, but it is a cleaner way to do it from the regulator's perspective. And ultimately, again, public protection is the big thing here. So making sure your receipts are super clean and all of your addresses and business numbers and everything reflect that. So making sure you've got everything in Jane on the back end structured in a way that reflects that you have either 2 different corporations or that you've got different people billing on your behalf. You can do that fairly easily, right? All the profiles in Jane, all the language back end stuff that you can do. You can make sure it's clean if you're all using the same Jane account. So right now, I've seen this question so many times. I've had it directed at me. How can is there a corporate structure that allows me to run a multidisciplinary clinic in BC? Right now, there is no structure in BC where multiple regulated professions can bill into one corporation or bank account, or create one single clinic that has one single entity that bills all of these things into one structure and collects all of the income into one and then pays it out to different professions. There is no structure in BC for this today. I have scoured the legislation. I have contacted the college. I have run this every way upside and down and around. And there is no structure that allows this. You either have to have parallel companies and rent to other modalities, or it's just a straight up rent model. So it's really challenging. And again, like I said, the college does recognize that this is limiting, but again, their interests are public protection and not your business growth. So again, to reiterate, it is the college who enforces this. It's not the CRA. It's not legal. It is the college who enforces this. And so, this is probably why we haven't seen this as a huge issue, because let's be real, the college only enforces things when we report them. And something's changing here with HPOA. The college has to receive a complaint in order to perform a investigation. I'm not going to the college and I'm not going to go rat out XYZ clinic over here because their corporate structure isn't correct. First of all, I'm not a jerk. I'm not going to go do that. And the college isn't proactively doing these types of investigations yet. And that's the big, big thing here with HPOA that I want to really put the bug in your ear about. That is changing. And we're diving into all the changes that are coming with HPOA a little bit later in the episode here. But I need you to understand that right now, HPA, the college isn't doing this proactively. No one is complaining about each other or ratting each other's business structures out. The only scenario in which this has happened and we don't really know the outcomes because they've all typically been settled before it's reached public knowledge. Um, all of the discipline that has happened or the complaints that have come in as a result of this have typically been from insurers. So when an insurer is doing an audit on a clinic and they realize that all the money is going into one corporate account and they're like, what? They're the ones that are usually putting the formal complaint in. And there are examples of this happening within, the physician corporate structure, dentistry. There are examples of this. There are none on the public roster of physiotherapy specifically, but there are precedents in other professional permitted corporation structures. But a enforcement or investigation that might create disciplinary enforcement would happen through a complaint to the college. The college would investigate. So this might come from a patient complaint. It might be another person in the profession. It might be an insurer. It might be like the permit renewal might trigger something. Or it could be a number of things. But under HPOA, there's some big things that are shifting. So we'll dive into that. But what may happen is when the college does actually look at this, they're going to look at your corporate documents and your permits. They're going to look at your billing records. They're going to look into your bank account flows in and out. And they're going to look at your marketing language. Like this is something that the college has really been strict on. And I've seen people have their wrists slapped for poor marketing representation. And so again, they're probably going to look at your receipts to make sure that it is uber clear which entity and business structure money is flowing in and out of. So that's going to be really, really big. And this big thing that they're asking is, does this corporate or business structure comply with our permit and corporate legislation permits? So some of the outcomes of an investigation, if found, if the college does do an investigation, most cases, again, like I've said, haven't become public or won't become public, but they may require corporate restructuring. They may provide like education or remedial education redirection for the corporation. There may be conditions on the permit. So they might reissue the permit, but they might say, you cannot do this, you cannot do that, you must do this, you must comply with X and Y. They might actually just refuse to renew your permit. Or ultimately, there could be fines, there could be revocation of the permit, or there might be reprimands, discipline, etc. But for the most part, it's actually probably just like conditions on your permit or revocation of your permit or refusal to renew. So we wouldn't want that, right? Like, because the benefit of having a corporate structure is that it protects you. If you have other staff, and this is another thing that I mentioned in the direct billing episode, you as a clinic owner, if you are billing on behalf of any of your other staff, you are responsible, right? You bill for someone else and they don't do their chart note. The insurer does an audit. They decide that session never happened. You, the clinic owner, own that unless you have a indemnity clause in your contract with which you can go back for the money after that contractor. Anyway, as an aside, again, a corporate structure protects you personally. If you own a home personally and you have a business and you have other staff and something happens where financially, legally, you're on the line and you get a huge bill or a legal case served against you, your corporation separates that from your personal assets. So huge benefit there. There used to be a lot more tax benefits to having a corporation. Recent changes in government and like capital gains taxes and all that crap that's happened over the last few years have really limited the financial benefit of having a corporation. So another reason why I decided to close mine, again, like the capital gains limitations in terms of savings from a corporation was just like, kind of like, why would I even bother saving through my corporation when the capital gains are, whatever. And then the moving money and you have to be making a certain amount of money through your corporation and paying yourself, in a way that benefits you from a tax standpoint to make it worth having a corporate structure. There's lots of other benefits and, ups and downs to having a corporation, but those are generally the two that people would opt for. So for me, when I incorporated, it was because I was hiring other staff. So I wanted that layer of protection. Now I don't have other staff. The corporation is dissolved. It's just me. I'm the one on the hook. So like if I'm the one that doesn't finish my chart note and then I get audited, like that's my own fault. Like shame on me. Right. And again, not running enough money through it to make it worth the like cost of having it. I'm certainly not getting any tax benefits for it. It was just like actually a financial liability for me. So anyway, total deviation. But yeah, the college is who ultimately is going to be monitoring this. So again, a lot of people are doing it anyway because they're like, well, I've never seen anyone punished for this before. There's nothing published. There's nothing, like, why would I care? And that's true, right? Like, there's not really a whole lot of precedent or like publicly recorded cases in BC that explicitly say that a clinic was disciplined for improper corporate structure and billing. But it doesn't mean that enforcement doesn't occur. It's just because most of these cases don't ever become so far into the public domain, whereas like a sexual misconduct, that's going to be public, right? Because like the public is deeply affected by that. But a lot of these things don't reach at that level. So they're probably happening a lot more quietly. Yeah, and a lot of them are a lot more just like administration type changes that are required. So, yeah, I think historically with HPA, it just like there hasn't been nearly as much complaint around it, right? So, yeah, other colleges certainly have had bigger enforcement and disciplinary pieces to this. So, the College of Physician and Surgeons has public record indicating that they've had disciplinary decisions that include like reprimands, fines, practice restrictions, suspensions. Um, and again, like most of the stuff that we see published is to do with like clinical and ethical misconduct. There's not a lot of like corporate billing structure, but there certainly are cases where things have been looked at. And so it's just that it doesn't reach that public level, right? So what's happening with HPOA? If you've been on any of the PABC calls around HPOA, you will have learned a lot of the things that are coming with it. Highly, highly suggest you go back and watch the webinars or the recordings. If you're a PABC member, they're in your dashboard or in the Circle app. HPOA really is tightening up the risk here. So there are broader disclosure expectations. Like we are now expected to share a lot more of our corporate structure and administrative backend with the government. There's also a whole lot more oversight. Like the colleges have so much more power with HPOA. They have a way bigger authority over the corporate permit aspect, and they have a lot less tolerance of risk. So, right now, HPOA is still being interpreted by the college. Our bylaws are not set yet. The college keeps releasing them in small chunks, and I encourage you to read them. I know it's going to take hours to get through everything, but this stuff is super, super important, right? So, the HPOA has not explicitly said that you must report your business structure, but the wording in it is such that the expectation for disclosure, if prompted, are going to be huge. And the whole philosophy of HPOA is moving from reactionary to proactive. So the language in HPOA gives the government a lot more ability to proactively do research. They can go in and they can investigate things without a complaint, as far as the interpretation right now sits. So now it doesn't require an insurer audit and subsequent complaint for the college to give you a little poke and say, hey, what's your corporate structure like? Hey, can I see some banking documents? The college and government have a proactive philosophy through this new set of legislation, which means investigations are going to be proactive. Complaints aren't needed. So right now, it doesn't explicitly say what that looks like, and it's still being interpreted. But I think we can expect a lot more proactive investigation moving forward after April 1st. The other part in it that really scares me is our duty to report. And this is where I keep referring to the big brotherism of it. Again, it's not been interpreted. The bylaws have not been created specifically around this. But if you read the wording in the legislation, there's a lot about what we have to report. If we believe a fellow colleague is not fit to practice, we have to report that to the college. If someone is sick, we have to report that to the college. It's kind of gross, quite honestly, when you go in there and read it. And so while it doesn't explicitly say that if we are aware of someone's corporate structure not being in line with HPOA's expectations, that we have to report it. But my fear is that that expectation is going to exist. And the other part of this is that discipline is going to be subcontracted to it's delegated to a third party. There is going to be a third party disciplinary tribunal. And so this goes for, all of our practice misconduct, all anything misconduct, any complaints that are served are going to a third party tribunal. It's going to be outsourced. And so the outcomes of that are going to be a lot more unpredictable. And again, we are losing our self-governance. The whole point of a college previously was that we were self-governed because we were the experts in our field. HPOA is moving to a board that is appointed and has members of the public, so people who are not experts in physiotherapy. I find that really scary in a way. That discipline is now going to be outsourced to people who are actually not physiotherapists, potentially people who don't actually understand the profession in and out like we do. And so the outcome of a disciplinary hearing is not entirely up to physiotherapists anymore. There are going to be people who are not experts that are going to be contributing to that. And so because of all these philosophical shifts that are happening with HPOA, I have a lot of fear around corporate structure and billing structure and just finding ways. It just feels very draconian and big brothery. And it feels like, any opportunity for, disciplinary action or cleaning up or protecting the public will be potentially enforced. And so I really feel that if, any of the things I've brought up here in this episode apply to you, I would really encourage you to revisit your structure, your contracts, and all of these things before HPOA comes out, because we don't know what it's going to be looking like. But I really don't want it to be a physiotherapist or a physiotherapy clinic or a healthcare clinic that sets the precedent in a court, right? Because all of this legislation is going to be new. There are no precedents set anymore. This is a whole new set of jargon and legalese that we need to sift through. And, these things like duty to report, the outsourcing of disciplinary action, as well as just the philosophical shift from reactionary to proactivity within HPOA is these things are a bit jarring. And maybe nothing will happen. Maybe they're just so overwhelmed with paperwork and, sifting through all of this that like it's not even on their minds. But I still don't love it. And you shouldn't either. So, with all of that said, I do have to say that the college does know that this is limiting from a business perspective. That does not equal permission. That does not mean you get to just like bypass everything HPOA and HPA say. I was on a webinar the other day that the college put out about HPOA, and someone asked a question about corporate structure and how it changes there. And they basically said it doesn't change. Everything from HPA and the restrictions that are there do continue to apply. And they said, however, they are considering in the future finding some form of collaborative agreement where multidisciplinary clinics may be able to act together. But that has not happened yet. There is nothing there that has allowed that yet. There is no structure. There is no legislation around that yet. So that has not yet changed. But what it does tell me is that the college recognizes this as a business growth issue. But what it does not do, it does not allow you to explicitly override what the legislation says. So they know it's restrictive. They understand multidisciplinary care is a huge part of it. I mean, like, for crying out loud, they encourage us to be multidisciplinary when we're in school. Like, what? So anyway, the fact that they've not acknowledged, even in an email exchange that I've had with them, that they realize this is limiting, and that on the webinar, they acknowledge that. Doesn't mean they've changed the legislation, but it does mean that, there is a bit of a, kind of optimistic outlook here that maybe in the future something will change. But for now, nothing has changed. This is not a free for all. This is not a do as you want corporate structure wise. This is a try to keep it as clean as possible because the rules are changing and becoming more tight and more restrictive, likely. So if you think your structure needs an overhaul, let me know. This is what I help with. This is my bread and butter when it comes to consulting and white glove services. So I really would like to help you there with that. There are ways around it. Like I said, there are structures that do work. There are, parallel corporate structures. Yes, that's more expensive, but it is far more safe from that regard. Yeah, there is ways to make this work that allow you to continue to run a multidisciplinary clinic without losing other practitioners or services. So yeah, it's not like, hey, you got to close your clinic down. It's just like, hey, you might need to like renegotiate some of your contracts and your corporate structures here. So yeah, bit of a like downer kind of episode, bit of a yeah, like maybe scary, maybe not scary, but like one that's sort of like, oh my God. So yeah, I'd love to hear from you. I would love questions, like if you have heard anything different from anyone at the college, or like if you have any other like hot tips here, I'd love to hear it because yeah, this is one that I was quite shocked. Like when I started consulting, I was doing some research in terms of like how I needed to structure that business and was like really quite shocked that yeah, I like uncovered all of that. So I'd always heard, I remember like starting my career and being like, yeah, you're not even, it's illegal for physios to fee split with chiro, so like don't go work at a chiro clinic. And I just like never really even understood that, and I tried to find it in the bylaws, couldn't. Like I was like, well, okay, whatever. And yeah, it's actually the corporate structure piece. So that's where it lives. So again, would love your thoughts, your feedback. And yeah, if you want to just chat about your structure, I'm here and super open to this. And like I said, again, I'm not a lawyer. I'm not an accountant. These things are best when you do restructure or go through any sort of like renegotiations on your contracts. Happy to consult on that. But ultimately, like the legal and accounting services that you contract are going to be essential with this, and make sure they're familiar with the new HPOA legislation when you do hire them for these things. So anyway, thanks for listening. I hope I didn't jar too much in there for you. But I think this is a really, really important topic to dive into. So I appreciate your listens and your engagement on this, and I will talk to you soon. That's it for this episode of The Health of Business. If you're navigating any of these challenges in your own clinic, know that you're not alone. If you're interested in working together on any of these challenges in your business, head to danielleboyd.ca to learn more about my consulting offerings and to get in touch. Catch you next time on The Health of Business.